Mwinga, and who is also the WHO representative in Uganda, joining us. Dr. Marie-Roseline Belize, our Regional Emergency Director, and Dr. Patrick Otim, the Program Manager for Emergency, are also available to answer questions. I now invite Dr. Janabi to give us an update on WHO support to the Ebola outbreak in DRC and Uganda. Dr. Janabi, over to you.
Thank you, Moderator Collins. Good afternoon. Good morning, good evening, and bonjour, wherever you are. And welcome to all the journalists joining us today. I'm pleased to be joined by Professor Kilimali from Democratic Republic of Congo and Professor Charles Toraro from Uganda. I thank them both for their leadership and partnership as we respond to the Ebola outbreak together. Today's briefing is an opportunity to share with everyone where we stand, where we came from, the progress made, the challenges that remain, and what is needed to bring this outbreak to an end. The outbreak of Budibunyo Ebola virus disease is one of the most significant public health events confronting our region this year. With over 1,400 confirmed cases and over 400 deaths, it is now the largest Budibunyo Ebola outbreak ever recorded. And I do repeat, the largest Budibunyo, not the largest Ebola outbreak we have ever recorded. To put this perspective, the outbreak has already surpassed all the previous Budibunyo Ebola outbreaks combined. In Uganda in 2007, we all recall the virus caused 131 cases and 42 deaths. In the Democratic Republic of Congo in year 2012, it caused 57 cases and 29 deaths. But today we are responding to an outbreak of an entirely different scale. The situation remains serious. Transmission continues in small number of hotspots, and weekly case numbers have reached the highest level since the outbreak began. At the same time, I want to acknowledge the leadership of the governments of Democratic Republic of Congo and Uganda, and the dedication of our frontline health workers who continue to serve under very difficult circumstances. WHO is working alongside both countries, Africa CDC, and many partners in a very collective effort to stop Ebola at source. Yesterday marked an important scientific milestone with the enrollment of the first patients in a WHO-supported clinical trial evaluating potential treatments for Budibunyo Ebola. For the not defeated by commitment alone. They are defeated by commitment backed by resources, speed, and partnership. But let me end on a note of hope. History has shown that Ebola can be defeated when communities, government, and partners work together with urgency, determination. We have overcome major outbreaks before. Democratic Republic of Congo have managed 16 of the 17 Ebolas before. We can do so again. The progress we are seeing today, the solidarity across the borders, and the scientific advances now underway gives us confidence that this outbreak can be brought under control. If we sustain the momentum, the story of this outbreak will ultimately be one of life's resilience demonstrated, and stronger health security for the future. Together, we can turn this moment of challenge into an example of African solidarity, scientific innovation, and collective action until that goal is achieved. Back to you, Collins.
Thank you, Dr. Janabi. Thank you, Dr. Janabi. I now call on Professor Pierre Akilimani for an update on the current situation in DR Congo. Professor Akilimani, you have the floor.
I will give my talk in French, so please allow me to use French. I don't know if we have a translation team here.
Thank you. They are ready to interpret your remarks.
OK, merci beaucoup. Je souhaite donc la bienvenue à tout le monde qui participe à ces webinaires dédiés à la mise à jour de la situation épidémiologique, les réalisés, les défis et les perspectives en rapport avec l'épidémie de la maladie à virus Ebola due au Bundibugyo en RDC. Quelle est la situation actuelle en RDC? Les données au 1er juillet montrent que nous avons autour de 1460 cas confirmés, avec 422 décès confirmés dans 36 zones de santé réparties sur 3 provinces, avec une létalité globale de 31%. Notons que les 24 dernières heures, nous avons notifié 50 nouveaux cas, dont 50 en Ituri et 4 au Nord Kivu. Et 321 décès communautaires depuis qu'on a commencé, soit 3 décès sur 4 dans cette épidémie sont dans la communauté. Soit la majeure partie de la mortalité, comme vous pouvez le voir, survenant avant toute admission dans les structures de soins. Malgré ces chiffres effrayants des nombres de décès, nous enregistrons quand même des guéris, 213 patients guéris depuis le début de cette épidémie. Notons que la province du Nord Kivu affiche une létalité de 57%, presque plus de double de celle de l'Ituri en raison des admissions tardives et de la sévérité clinique à l'admission. Malgré ces chiffres qui peignent plus ou moins l'image de l'épidémiologie actuelle en RDC, quelques progrès ont été réalisés. En 6 semaines, notre riposte a enregistré des avancées significatives. Et l'épidémie est concentrée à ce jour dans 3 provinces actuellement, avec le site Kivu qui est devenu inactif depuis le 26 mai, soit 38 jours déjà. Nous espérons bientôt la province du site Kivu quittera dans nos statistiques parmi les provinces actives en termes d'épidémie. Les taux de suivi des contacts a progressé. On est parti avec des valeurs inférieures à 30%. Aujourd'hui, nous sommes à 83%, montrant un certain niveau de progression, quoique nous n'avons pas encore atteint les cibles attendues d'au moins 95%. La décentralisation au laboratoire continue. On est parti de rien jusqu'à avoir autour de 10 laboratoires opérationnels après cette décentralisation. Et la capacité nationale de traitement comprend désormais des 700 lits disponibles répartis dans les 22 centres de traitement Ebola dans les 3 provinces. Et en perspective, nous voudrions vous signaler que nous allons augmenter cette capacité de lits pour atteindre au moins 1000 lits disponibles dans les 2 semaines qui suivent. Les investigations s'améliorent. Dans les 24 dernières heures, elles s'est redressée à 84% au niveau national. Mais nous avons aussi le volet de recherche qui a été lancé. J'ai entendu notre collègue dans le mot d'ouverture. L'essai Clinic Partners venait de commencer depuis hier et l'objectif, c'est d'enrôler autour de 100 patients ou plus pour étudier l'efficacité des traitements proposés, parmi lesquels les MBP 134, lesquels molécules sont déjà en RDC. Et hier, on a commencé l'inclusion des patients pour cette étude. À part l'essai Clinic Partners, nous avons aussi l'étude EBOPEP qui va s'intéresser au contact à haut risque et pour réduire la survenue de la maladie parmi les personnes, le contact à haut risque. Malgré ces progrès que nous présentons, nous devons être réalistes. Il y a des défis qui restent. Quels sont-ils? Nous allons citer, sans être exhaustifs, la saturation des structures de prise en charge dans certaines zones à forte transmission, la détection et la consultation tardive qui alimentent les décès communautaires. Comme vous l'avez vu, presque 3 décès sur 4 surviennent dans la communauté dans cette épidémie. L'insécurité et les contraintes d'accès dans les zones de conflit aussi nous posent problème. Mais signalons également l'engagement communautaire qui demeure encore un défi à relever dans certaines aires de santé, comme vous l'avez suivi dans les médias, l'incendie des centres de traitement, zones de santé des Nyanya. Quelles sont les perspectives malgré ces défis? Nous ne sommes pas là pour chialer, pour pleurer. Nos priorités stratégiques pour les prochaines semaines sont notamment d'accélérer la décentralisation pour le passage à l'échelle des opérations au niveau des zones et aires de santé. Mais par rapport à la mortalité, nous avons des audits systématiques des décès et des investigations approfondies dans les zones avec une létalité élevée au niveau hospitalier et communautaire pour adapter les protocoles de prise en charge. Nous envisageons aussi l'intensification de la détection précoce au niveau communautaire dans les zones hotspot. Mais enfin, disons la décentralisation de la prise en charge par des structures de transit et l'isolement des proximités, assurant qu'il y ait un bon service de triage au niveau de chaque formation sanitaire afin d'éviter de contaminer les autres malades qui viennent pour des consultations autres qu'Ebola. L'autre point, c'est l'optimisation diagnostique par le déploiement des laboratoires mobiles et des tests de diagnostic rapides. Comme vous pouvez vous en rendre compte, notre objectif est clair, réduire la létalité, restaurer la confiance des communautés et interrompre la transmission par une riposte fondée sur les évidences scientifiques, comme vous voyez l'étude EBOPEP et partenaires, et l'excellence opérationnelle que nous envisageons. Cette épidémie est encore active, il faut le dire, dans les provinces de l'Ituri et du Nord Kivu. Des progrès significatifs ont été réalisés, mais nous restons prudents afin de passer à l'échelle les opérations au niveau des aires de santé. Nous disons beaucoup reste à faire et nous pensons qu'à partenaires, sous le leadership du ministère de la Santé, nous arriverons. Je dis et je vous remercie, chers collègues.
Merci beaucoup, Professor Akilimali. Thank you, Professor Akilimali. I now invite Dr. Charles Olaro to give us an update on the current situation in Uganda. Dr. Olaro, you have the floor.
Thank you, and a very good afternoon to all of you. Good morning, wherever you are. I want to recognize the Regional Director of Africa, Regional Office, the World Health Organization, colleagues, the panelists, ladies and gentlemen. Uganda continues to respond actively to the ongoing Ebola disease outbreak caused by Bundibugyo virus strain affecting parts of the Democratic Republic of Congo and Uganda. And as of the 2nd July 2026, Uganda has confirmed 20 cases. 15 of these cases are imported cases, and 5 of them are Ugandans, of which 4 are health workers, and 1 is a driver. It is important to note that all the Ugandan infections were detected while they were in institutional quarantine, following exposure to a probable case. It's encouraging news to note that no community transmission has been observed, and our surveillance and response systems remain fully activated, rapidly detect and contain any new cases. Since the start of the outbreak, we have listed 836 contacts who have been listed and followed up, and I want to say that all of them have completed their mandatory 21 days of follow-up. Uganda, as all of you are aware, has a significant experience in responding to Ebola outbreaks and other public health emergencies. Through these experiences, we have definitely learned that acting quickly, strengthening surveillance, engaging communities, rapidly deploying trained response teams, maintaining transparency and public trust, these lessons have guided our response from the very first. Currently, we have over 2 laboratories which are deployed across the borders, 1 in the northern part, 1 in the western part, and then leaving the capacities which are available within Kampala, which are more than 4 of them. Another important lesson is in the previous outbreaks is the most effective when government leads and the partners align to that. So we continue to uphold the principle of 1 plan, 1 budget, and 1 monitoring and 1 evaluation framework. So this ensures that all the interventions are coordinated by government, leadership resources are directed to priority areas. No, we minimize duplication, but accountability is also strengthened. And so partners provide technical expertise, logistics, financing, and such capacity, but they still support a national response. And this model has been instrumental in Uganda's success in managing the previous outbreaks. We have also learned that a strong partnership is essential, and I want to thank WHO, Africa CDC, UNICEF, all development partners, research institutions, and the community leaders, and all the other political leaders for working in partnership, strengthening surveillance, laboratory capacity, case management, risk communication, logistics, and emergency response. Our experience has constantly shown that early coordination and collective actions saves lives and accelerates outbreak containment. At health facilities across the country, especially at the border points, we have strengthened screening, triage systems, and equipped all our health workers with infection prevention and control measures. Treatment facilities have been activated, laboratories remain on the higher alert, and rapid response teams and investigate alerts across the country. At the points of entry, along our borders with the DRC, we have definitely got screening and surveillance, which has been intensified. Uganda and the Democratic Republic of Congo are working closely together through a joint cross-border response mechanism, and an MOU has been signed on for this. And so this was launched in Aru, and so we are sharing joint information on surveillance, strengthening our treatment capacities in the border areas of Aru and Rampara. This collaboration recognizes that infection diseases don't not respect borders, and that stopping transmission requires a coordinated regional actions. So as I conclude, I want to speak to the people across our borders. They should remain calm, but be vigilant, cooperate fully with the health workers and the surveillance teams. Critical public health measures are designed to protect families and communities and should not be a source of stigma. If you or a family member develop signs and symptoms consistent with Ebola, seek medical attention immediately and report through the establishments of health system. Finally, I want to acknowledge the support of all the partners who have worked with us. I want to acknowledge my country, WR and her team, and all the other partners for working with us in strengthening our response and working and in supporting and in containing the outbreak in this region. Thank you very much.
Thank you, Dr. Charles Olaro, for the updates. We now open the floor for questions. And you can submit your questions using the Q&A function on the Zoom. And please, when doing so, kindly include your name and the media organization that you represent. To begin with, we'll go live to Nigeria, to Paul Adepoju. Please unmute him. Paul has a question. Paul Adepoju from Nigeria.
Yes, thank you very much. Can you hear me loud and clear?
Yes, we can, Paul.
Yes, thank you very much. So my question has to do with the current clinical trial ongoing. I would like to know if there are concerns that a lot of people would have already been doing something to protect themselves. So what is being done to ensure that we actually have the results from these clinical trials are reflective of the impact of the potential target, potential tool being tested, not just something that is already clouded by what people have used before. And for the Uganda minister...
Thank you, Paul. And this question I will ask Dr. Marie-Roseline Belizer, if you could kindly respond to this question. Please unmute Dr. Marie-Roseline Belizer to respond to the question from Paul.
No, good morning, everyone. So thank you, colleagues, for orienting that question to me. So I will give the question to the Professor Akilimali, who is the IM and supervising this research. Prof. Akilimali, je voudrais vous passer la question en tant que responsable national qui supervise cette recherche. À vous.
Merci beaucoup. La question, c'est une question pertinente. Comme vous le savez, le virus Bundibugyo, à ce jour, nous n'avons pas un traitement spécifique prouvé comme on l'a avec la souche Zaïre. Et donc, cet essai clinique va permettre de montrer l'efficacité qu'on n'a jamais montrée, même si dans les études précliniques, on a vu l'efficacité des monoclonaux tels que MBP 134, mais dans l'espèce humaine, chez l'espèce humaine, ceci n'a pas encore été réalisé. Et cet essai, c'est une étude qui est réalisée pour la première fois dans le cadre d'un protocole qui est standardisé, adaptatif, avec plusieurs partenaires des différentes institutions, y compris l'OMS, Oxford, l'INRB. Donc, nous-mêmes, le Congo, nous y sommes et ce n'est pas vraiment un travail de l'extérieur. Nous nous approprions de ceci. Et les résultats de cette efficacité vont permettre donc de répondre à des épidémies futures, même aussi au cours de cette épidémie. Mais en dehors de cette essai partenaire, mais il y a aussi l'essai EBOPEP qui permet déjà avec les prestataires et les contacts à haut risque de les protéger pour éviter la maladie en leur donnant ces médicaments dans les cadres de la prophylaxie post-expositionnelle. Voilà un peu ce que je peux dire en résumé à la question de notre collègue.
Thank you, Prof. I think there is also another question that comes to you, Prof. And the question is, what progress are you witnessing as the response progresses? What are some of the biggest operational challenges that you are facing on the ground?
Merci beaucoup. Par rapport aux défis, déjà, nous voudrions vous donner quelques éléments qui font que cette épidémie a donné l'impression, ou par certains, que ce n'était pas sous contrôle, mais nous sommes en train de contrôler la situation. Voici quelques challenges que nous avons et que d'autres pays ne connaissent pas. Premièrement, nous avons cette épidémie qui survient dans des territoires avec insécurité, avec des groupes armés. Regardez, avec les groupes armés, parmi les stratégies pour rompre la chaîne de transmission, c'est d'identifier les cas, mais aussi de lister tous les contacts et de les suivre régulièrement, théoriquement pendant 21 jours, pour s'assurer que ces contacts ne vont pas faire la maladie et donc la chaîne ne va pas continuer. Mais malheureusement, dans les contextes de l'insécurité, des fois, c'est difficile de voir tous les liens parce que les prestataires et les relais communautaires, des fois, sont butés à ces problèmes de sécurité. Deuxième challenge, c'est que la province de l'Ituri en particulier et surtout la zone de santé de Mongwalu où l'épidémie a commencé, c'est une zone de santé minière. L'exploitation minière fait que les populations venant d'ailleurs viennent à Mongwalu et dans d'autres sites miniers pour l'exploitation de l'or. Et donc, à ce niveau, tout ce qui se fait favorise la transmission de la maladie parce qu'il y a une forte mobilité, ça c'est un autre facteur, une forte mobilité qui pousse les personnes de venir rechercher l'or dans les milieux où l'épidémie s'est déclarée. Maintenant, autre challenge, c'est que lorsque nous sommes venus, nous devrions mettre les systèmes en place et en mettant ces systèmes en place, nous devrions harmoniser notre réponse avec les parties prenantes qui étaient sur le terrain et ceci, ça nous a pris un peu de temps et maintenant les choses sont mises en place et nous espérons dans les jours qui suivent, nous allons avoir des résultats positifs, mais nous ne baissons pas les bras, nous ne sommes pas trop, nous ne disons pas que nous avons déjà gagné, mais nous voyons la lumière devant nous, quoique il y a encore des défis. Voilà par rapport aux défis. Ce qu'il y a comme succès que nous avons déjà depuis qu'on a mis en place cette riposte. Premièrement, si vous comparez la riposte actuelle et les ripostes antérieures, ce n'est pas pour être trop dans le sens de se louer, mais ensemble, le gouvernement congolais, le leadership de notre président de la République, le ministre de la Santé, mais aussi les partenaires qui nous ont beaucoup aidés, dans si peu de temps, des indicateurs, le processus montre que ce qui a été produit au cours de cette épidémie, durant les 6 premières semaines, on ne l'a jamais vécu, on ne l'a jamais eu. Vous savez, aujourd'hui, nous avons autour de 700 lits pour accueillir les malades. Nous avons des laboratoires presque partout. Avant l'épidémie, nous n'avions pas les laboratoires partout. Et l'avantage encore avec cette riposte, nous ne faisons pas que de la riposte, mais nous renforçons aussi le système de santé de la RDC, en particulier dans les provinces touchées. Bref, c'est vrai, il y a des challenges, mais vous voyez qu'il y a l'espoir et nous y allons et nous espérons vaincre cette maladie avec l'effort de tout le monde et nous avons l'espoir. Merci.
Merci, Professor Akilimali. We have a question from Annette Mirzinian. Annette, could you please unmute Annette so that she can ask a question? Annette, could you please also tell us which media organization you represent and who you want to respond to the question? Please unmute Annette. Hello, Annette. Whilst waiting for Annette to respond to her questions, can I take the Dr. Olaro, please? This question is coming to you. Uganda has experience of responding to Ebola outbreaks, and what lessons from previous outbreaks are guiding the current response? This question goes to Dr. Charles Olaro.
Okay, thank you once again. And I must say that whereas our colleagues in the DRC, this is their 18th outbreak, for Uganda, definitely this is the 19th Ebola outbreak. And important lessons from the previous outbreaks have been that the outbreak control government has been on top of it. From the president, they're putting in place a national task force who have activated all our up to the sub-national level, the districts. And so we've been able to develop that framework. But at the same time, as we respond to Ebola, we also make sure that all the other services continue, immunization, maternal services, referrals, malaria, and also people are able to access their life-saving medicines. So we also learned that definitely we have strong partnerships. It becomes a whole of government. We've been able to work with our partners closely, and we elucidate one plan, one budget, and one monitoring and evaluation. And so we've been able, communities have been really at the forefront of leading outbreaks, as all of you are aware that these outbreaks start in communities and end in communities. Whereas this time the community which were involved was mainly urban, but we still were able to work with them. But also I must say that with now the digital systems, we're able to follow the truck drivers from the border points up to the exit and even over the 21 period. So most of them we are able to follow them. We have also strengthened infection prevention and control aspect of the health workers, and we are regularly speaking to the health workers. And then I think also the aspect of pre-positioning supplies to some of at our regional emergency operating centers. This has been able to work. So when you start, like when we had this outbreak, we are able to activate the treatment center within 24 hours because we have the EMTs which are already trained. We're able to call them within 24 hours where the place we're ready to take the first patient in case we had it. So really the aspect of it is really harnessing the preparedness and then the resilience which comes with all the previous outbreaks. And then
Thank you so much.
And then laboratories. I think our other strong point is really laboratories, because everything is that if you have functional laboratories, because even within 24 hours, we're able to do a genomic sequencing, and it was able to tell us that it was not it was still related to 2007, but not aligned to it. And so we're able to really to follow it very closely. So thank you.
Thank you, Professor Dr. Olaro. I now understand Anne is back. Anne, could you unmute yourself and ask your question, and let us know who you want to respond to the question.
Can you hear me?
Yes, we can.
Yes, so it's Anaïd from Reuters. Yeah, I heard the Professor Pierre Akilimani speak about, new cases in Ituri and North Kivu. So I'm trying to understand what's happening in South Kivu. Is the outbreak contained? What is the situation on the ground? Also, we heard that other provinces might be affected, like Chopo and Uele. Could you give some details on what's happening in these provinces as well? Thank you.
Thank you, Professor Akilimali. This question comes to you. You have the floor.
Yeah, merci beaucoup pour cette question, une question très, très pertinente qui va aider la compréhension de la situation. En ce qui concerne la province du Sud Kivu, comme nous l'avons dit dans le mot d'introduction, et ça fait déjà 38 jours que nous sommes en train de faire le compte à rebours à ces jours, et bientôt, probablement, la province du Sud Kivu va parmi les provinces en épidémie, donc actives par rapport à l'épidémie. Sur le terrain, nous continuons donc à suivre les protocoles pour que nous totalisons les nombres de jours requis pour que nous puissions dire que Sud Kivu est actuellement hors épidémie. En ce qui concerne les provinces de Haut-Uele et de la Chopo, laissez-moi vous dire d'abord une chose, c'est avec la mobilité, la forte mobilité que nous avons dans la province de l'Ituri, avec les échanges et consorts, disons aussi avec l'insécurité, pour faciliter le contrôle. Parce que parmi nos piliers, dans le cadre de la prise en charge, nous avons les piliers point d'entrée, point de contrôle. Et à ce niveau, avec nos services, on contrôle les entrées et les sorties dans des entités pour s'assurer que, tout contrôle qui est listé et qui était autour d'un cas confirmé, qui soit suivi pendant 21 jours, qu'on s'assure que ce contact ne va pas faire la maladie, mais aussi ne sera pas celui qui va prolonger la chaîne de transmission. C'est ainsi que, avec nos autorités, et nous saluons le leadership de notre ministre, son Excellence Samuel Roger Kamba, qui a pris un arrêté qui, parmi les dispositions, interdit tout contact de quitter son lieu avant la fin de la période d'observation des 21 jours. Ceci étant compris, nous avons une zone de santé qui est un carrefour à partir de cette zone de santé qui est dans la province de l'Ituri. À partir de Nyanya, vous pouvez aller à Chopo. À partir de Nyanya, vous pouvez aller à la province de Haut-Uele. Qu'est-ce qui se passe? Nous avions un cas, une femme, un militaire, qui a quitté Bunia, qui est partie à Nyanya, et c'est cette femme-là qui a été à la base de l'épidémie dans la province de Nyanya, parce que jusque-là, Nyanya n'avait pas de cas confirmés d'Ebola. Et cette femme est décédée à Nyanya. Lors des cérémonies funéraires, les membres des familles sont venus pour assister.
I think we've got Professor Akilimani's network has come down. We will come back to Professor Akilimani when he's back online. Let's move on. I have this question for Dr. Janabi, WHO Regional Director for Africa. Dr. Janabi, from a regional perspective, and how serious is this outbreak? And what does it tell us about health security in the African region in general? And also, what is your message to partners and donors who are watching this briefing today?
Yeah, thank you very much, Collins. I'll be very brief. How serious this outbreak is? It is serious. It is serious. If you look, I look at it two aspects, the operational side and the epidemiological side. If you look on operational side, yes, we are making progress. We are seeing more patients coming to our center, treatment centers. That's why they are over 95% occupancy. It means the community have started to believe in us. But if you look on epidemiological side, no, let me just few more examples on operation, and I will allow my Red and WR to top up. We were testing 30 samples, 20 samples a day. Today we test over 2,000. We started from 0 labs. Now we have 10 laboratories which can do that. So it means on operational side, we're on the right direction. You see, DRC Congo, we have discharged over 200 cases. They've already gone home because of care. So, but if you look on epidemiological side, the number of cases is going up. And if mathematically, if you look on projection, maybe sometime next week or mid of this month, we might reach 1,500 confirmed cases in Democratic Republic of Congo. You have heard about contact tracing at 83% in DRC, 100% in Uganda. To our partners, what would I say? You saw our budget, the initial budget of $518 million. There are a lot of pledges, but the money is not there yet. So I would really encourage those listening and our reporters, to all those who have made pledges, to go ahead and contribute the amount which they have said. So this is what I would say. And I think Dr. Rosemary and Kasonde and Anne, they're online. They can top up what they see on the field. I was on the field for 3 days, but these are the people who have been in the field from the word go. And today we are almost 6 weeks into 44, 45 days of response. I really see the progress. Thank you. Back to you, Collins.
Thank you, Dr. Janabi. Dr. Anancia, could you please weigh in on RD's remarks? I think whilst we're waiting for Dr. Anancia, I think we'll go to Dr. Marie-Roseline Belize.
Okay. Thank you. I can put my video. Yeah, thank you. I say, as Aldi already mentioned, this outbreak is serious for very several reasons. One of them is the number of cases, as is mentioned, and the second is the number of deaths. And we continue to have a high number of deaths in the community. So that means we have colleagues, members of the population who are dying in the community without accessing the health system, or who still don't believe in the health system. So that means another layer of, I can say, challenge that we still have, as my colleague mentioned, Pierre Akilimali. It means we still need to convince the community in order to accept that the existence of the disease, so they can access early healthcare system, so we can save them. So when we look at, for example, globally, as the question mentioned, I think it's also serious for global health security, because this outbreak has 5, I can say, consequent pathogen. The fatality is not that high than Zaire, but we're still having a lot of death, happening. The second is that the outbreak is happening in an insecure environment. So this insecure environment also put the team in the field in very difficult condition to reach the last mile, where we can find all the people affecting. In one presentation, we show how the places with the insecurity are also the most affected places, where we have a lot of concentrated cases in those places. And we also have to say this is also the risk of a border. As you see, 15 of 20 cases in Uganda came from DRC. So that means there is a spread. And this part of the DRC border with South Sudan and also with Uganda. And the capacity in South Sudan is very concerning on managing that. And the other things also I can mention why it's really important for the global health security is the lack of resources, financial resources in order to respond. While the operational needs is increasing, but the finance is not following the same, level of needs that we have in the field. And also, in a global health perspective, we can say it's not only because Ebola will become a global pandemic. We are not saying that, but it's also concerning, as you know, a virus doesn't have border. So the pathogen is circulating in a complex humanitarian and security environment where transmission can persist, spread regionally, and also periodically can export if not contained or if it is delayed. So this is what I can say regarding the global health security perspective. Over to you, Collins.
Thank you, Dr. Belize. May I ask Dr. Anansia to weigh in as well?
Yes, thank you very much, Collins. What I would like to add is the epidemic of infodemic, which really jeopardized the respect of the international health regulation and in general put the entire health security at risk. You've seen infodemics is circulating, and this infodemic create sometimes panic reaction. You've got countries who are closing their borders. You've got airline companies who are now requesting, for example, unnecessary test, laboratory test to enter their airlines. And this is really not at all in respect with the international health regulation. And those panics really, and those overreaction really jeopardize the response. We don't want to isolate the poorest population, which is in Ituri. Ituri, as you heard from my colleagues, there is a humanitarian crisis, there is insecurity. We need to ensure that the population can keep receiving the humanitarian assistance, the response to Ebola. We cannot isolate this population. We need to ensure that this population can still have source of livelihood by enabling the humanitarian assistance and the Ebola response to feeding. We know that outbreaks and epidemics goes in the poorest of the poor population. So we need to make sure that this Ebola response will also enable to continue and to enhance the humanitarian response so that those communities can get out of this Ebola stronger, more resilient, and that in this way we can demonstrate that by strong preparedness, evidence-based approach to response and resilience, we can really strengthen the resilience of those communities and those nations, and therefore strengthen overall regional health security and strengthen the international health regulation. Thank you.
Thank you, Dr. Anansia. May I call on Dr. Mwinga Kasonde to tell us about the support that partners are providing and also a bit of updates about the Ugandan's response. Dr. Kasonde, you have the floor.
Thank you very much. I would just like to just add something about why we think there's been containment in Uganda for the outbreak that we have. One, the transmission has been limited to 2 chains of transmission, but also the robustness of the response that Dr. Olaro had indicated has really helped. The contact tracing that he had talked about has been over 90% through most of the response and then got to 100%. The active case search that was done across the area to try and comb out any cases that may be in the country was also something heavily supported, I think, by different partners. And in addition to that, there's been mortality surveillance of non-trauma deaths that has been happening in the high-risk districts to make sure that you try and find the cases. In addition, I think partners have also supported screening of points of entry, including the Entebbe International Airport, to try and ensure that cases are not exported to any other place when the cases have been here. And this includes having people who are listed as contacts put on a no-fly list so that they are not able to get on a plane and leave the country if they are already supported. So he has mentioned that partners are supporting through the one budget, one plan of the government across the different pillars. And WHO does help to also do the tracking of partners across the pillars so that you know where different partners are working, what support they are giving, and when they are giving the support. So there's a large number of partners beyond WHO, Africa CDC, other UN partners, and also implementing partners that are involved in working with the government. Thank you very much. Back to you.
Thank you, Dr. Kasonde. We have a question from Emery Makumeno from BBC, and this question goes to Professor Pierre Akilimali. The question is that earlier today, there's been a report that over 70 frontline health workers have contracted the viruses, with 18 of them dead. Could you give us just a brief update on that?
Sorry, I didn't catch the question because I lose my connection. Sorry. Can you repeat, please?
All right, I'll ask the question again. The question is coming from Emery Makumeno from BBC. And the question is that earlier today, the response has reported that over 70 frontline workers have contracted the virus. And this has resulted in 18 of them being dead. Now, could you kindly give us an update on that situation?
Yeah, merci beaucoup pour cette question. C'est vrai, il y a quelques prestataires de première ligne qui ont été contaminés et aussi certains parmi eux sont décédés. Mais nous avons depuis lors renforcé la protection de nos prestataires, mais aussi le gouvernement s'est engagé pour honorer aussi ces prestataires qui sont morts sur les champs de bataille, et leurs familles ont été visitées et consolées dans ce sens. Mais nous sommes en train de renforcer encore la protection des prestataires qui sont en train de prendre en charge ces malades, et via aussi la vaccination qui va bientôt venir, nous espérons réduire aussi les risques de contamination de ces personnes de première ligne.
Thank you, Professor Akilimali. Dr. Anancia, do you have anything to say about this?
No, I think Professor Akilimali said it all. Thank you.
Thank you so much. I have another question from the same journalist, Emery Makumeno from BBC. And his question is that Africa CDC has reported that there is low reported high contact of contact, and we should be up by 20,000 to 40,000. He feels that Africa CDC feels that this figure is low. And what do you say about this, Professor Pierre Akilimali?
Africa CDC, l'OMS et le gouvernement congolais travaillent ensemble pour produire les CITREP et les analyses ensemble. Les chiffres qui sont publiés dans les CITREP sont endossés par l'Africa CDC et l'OMS, et les chiffres présentés, moi je ne connais pas d'où ça vient, donc s'il faut poser la question aux personnes qui ont parlé de ces chiffres-là. Mais ce qui est vrai, le taux de suivi des contacts est en pleine progression. Nous sommes aujourd'hui à 84%. Et les autres chiffres, moi, je ne peux pas commenter parce que je n'ai pas connaissance sur ça. Seules les personnes qui en ont parlé peuvent expliquer.
Thank you, Professor Akilimali. We are now coming to the close of this virtual press conference, and I'd like to invite Dr. Janabi to share just a brief word for the public about the outbreak. Over to you, Professor Janabi. Dr. Janabi.
Kindly, I couldn't hear you properly. Can you repeat the question?
So we are coming to the close of this virtual press conference, and we would like you to give your share just a brief remark, a parting shot for the public about the outbreak in general.
Yeah, thank you. Let me start by first thanking both governments, government of Democratic Republic of Congo, the government of Uganda, my colleagues who are in the forefront, the partners, all partners from CDC Africa, UNICEF, WFP, and all others, the NGOs we are working together with. For the public, I would really, my sincere request, we really appreciate the community starting to understand, but I think for the most reliable information, get them from the respective organs, starting with the governments of both Uganda and Congo. These are the most reliable. And then we are there on the ground to continue to bring awareness. About Ebola Budibunya, the current one, is still serious. We should take all the measures which are necessary. We are doing our part. You heard about the number of our frontline workers who have been infected. We have taken a lot of measures on IPC, infection prevention and control, by having things in place, the PPEs, the gloves, the antiseptics, but even education to our own staff, reminding the use of the standard operating procedures on whatever procedure. My biggest request to the community is that please allow us to do the safe, dignified burials when your loved ones, we know everyone is touched, everyone is in pain, but I think it would be more wise to follow the procedures so that you don't come back to the graves, because you might be infected and then unfortunately you lose your life. It will take us back to. So my sincere request is allow us to do a very signified, safe, dignified burial. Otherwise, I thank everyone. I thank the media. Please spread what you have heard from us, and for all the countries, as Anansia said, closing the borders, travel restriction, we don't have any scientific evidence of it helping to prevent you getting or reaching out. So I thank you. Back to you, colleagues.
Thank you, Dr. Janabi. We have now come to the end of the press conference, and thank you to all the panelists and also to the media. Thank you so much. Thank you.
Thank you, colleagues. Bye-bye. Thank you, colleagues.
Bye-bye.
Bye-bye.
Okay, thank you, everyone. Bye-bye. Thank you.